Hi, hope you guys are all doing fantastic. Welcome to our YouTube channel. Today it's very sunny and sweaty, so I had to use this. In this video, we'll highlight acute rheumatic fever. Most importantly, the core of this video is the diagnostic criteria of acute rheumatic fever. We'll look into revised Jones criteria and various parameters mentioned in various criteria. And most importantly, to make things even more interesting and fun and to enable you remember Jones criteria in a simplified way, I'm going to present you a memorable romantic love story. I hope you guys are ready. Let's go ahead. So what is this acute rheumatic fever? It's nothing but aberrant inflammatory response, or you can say in simple terms, improper immune response to a previous throat infection. So this throat infection, especially caused by group A streptococcus, right? So group A streptococcus pharyngitis can lead to acute rheumatic fever, especially in children between the age group 5 to 15 years, even though it can occur at any age. So we're talking about throat infection, right? But why are we even mentioning about heart issues, joint issues, neurological manifestations, etc.? Why is the immune response, leading to these kind of wide range of clinical manifestations? It's because of something called as molecular mimicry. In simple terms, a thief has entered into your house. So you call up the police. So the police enters. And along with shooting the thief, the police start shooting you as well, right? So that's what is happening. That's the gist of what's happening here. So the group A streptococcus antigens exhibit molecular mimicry to self-antigens. So this immune response can lead to wide range of clinical manifestations which include carditis, arthritis, chorea, skin manifestations like subcutaneous nodules, erythema marginatum, fever, polyarthralgia, lab changes like elevated erythrocyte sedimentation rates, increased C-reactive protein levels, and even ECG changes such as prolonged PR intervals, which has to be age adjusted, as you can see in this particular table. So why Jones criteria? As you can see, we have wide range of clinical manifestations which significantly differ from patient to patient, making the diagnosis of rheumatic fever very challenging. So we have Jones criteria so that we can come to a prompt diagnosis of acute rheumatic fever in order to instill appropriate treatment, again, in order to prevent long-term complications, one of which is rheumatic heart disease, which is associated with significant morbidity and mortality. So according to Jones criteria, the patient should experience two major criteria or one major criteria with two minor criteria with a previous group A streptococcal infection in order to establish diagnosis of acute rheumatic. So now what is that romantic love story I'm talking about? Let's look into that now. Hometown Cha-Cha-Cha 2. So last night when you're sleeping, you dreamt of a person called Zane. If you're male, assume that Zane is female. If you're female, assume that Zane is male. Or if you're gay or lesbian or bisexual, assume the other person so that you can have some romantic connection, right? Just imagine that last night when you're sleeping, you came across a person called Zane and you fell in love with Zane instantaneously. The connection was instantaneous in a dream. And you start researching, you wake up, you start doing some research extensively, and then you find out that Zane stays in Korea. So you decide to travel to Korea and meet the love of your life, Zane, so that you can have some romantic relationship with Zane. So you go to Korea and then you travel extensively. You search everywhere in Korea, day in and out, under sun, under moon, and then as a consequence, you develop skin conditions because of overexposure to sun, right? But you don't give up because Zane is love of your life. So you continue your search day in and day out. And in the process, you grow old and you develop joint problems, right? Because we're all humans, right? But still, you don't give up. You keep searching for Zane day in and out. And finally, a day comes where you'll meet Zane. And then you propose Zane. But unfortunately, Zane reveals that she is already in love and he is already married. And this leads to heartbreak. So you feel very sad for yourself, you feel disappointed, dejected. You know how it feels to experience heartbreak, right? So, not able to withstand this terrible news, you are hospitalized, right? In South Korea itself. I mean, if you wish to go to North Korea, that's a different entity altogether. But let's assume you are in South Korea, you have been hospitalized, and when the doctors came and checked, they see that you're experiencing fever, joint pains, and they take an ECG, which gives an abnormal reading, and then they check for your ESR and C-reactive protein levels. They all seem to be increased. So somehow the lab changes are not good, and you experience all these things in your attempt to meet the love of your life, Zen. And doctor gives you a diagnosis, and the diagnosis is nothing but romantic fever, right? So just remember this crazy story. Or you can create your own story as per your convenience or as per your own imaginative part. So this crazy story, crazy love story, helps you to remember all the criteria of rheumatic fever. The Jane's, not the Jane criteria, but zone criteria. With due respect to zone, I haven't named this person as zone, so let it be Zane. So as per zone's criteria, you have Korea, not this Korea, but CH Korea. 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 Right? So it sounds similar to Korea. Korea is nothing but involuntary, uncontrolled, jerky movements, right? It's a neurological manifestation. You develop subcutaneous nodules, skin lesions, as we discussed previously, and also you develop arthritis, carditis. So all of these fall under major manifestations, not necessarily in this sequence, but for you to easily remember, I put all of these major manifestations on one side, major criteria on one side. And then once you're hospitalized, the other criteria fall under minor criteria, which include fever more than or equal to 38 degrees centigrade, and then joint pains, arthralgias, ECG, which is abnormal with prolonged PR interval, and then elevated ESR and CRP values, right? So this is romantic fever. As we're discussing romantic fever, we can remember this love story as romantic fever. Or whatever suits you, whatever you find it crazy, so that ultimately the objective here is to remember this story. And ultimately, it's not just about remembering the story, but correlating the story with this criteria of Joan, right? So I hope you enjoyed this story. By the way, don't feel bad if you're not able to meet the person of your dreams. You'll attract the right person with right orientation. So this is in brief about Zone's criteria. I hope this video is helpful. And if you need any further clarifications or if you have any further queries, you can always reach out to us through mail at proudtobedentist@gmail.com 24/7. So in the process of searching Zen, do take care of yourself without developing these complications. All the